Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Today we're going to talk about something that affects nearly every man as he gets older, but very few men talk about openly: the prostate. Your prostate is a small gland, but when it starts getting bigger, it can quietly change your life. And most men ignore the early warning signs until the problem becomes severe. Let's go through 7 early signs your prostate may be getting bigger, why they happen, and what you can start doing today naturally to support prostate health. Most men don't notice the moment their prostate begins to change. There is no alarm, no warning light, just small signals that are easy to dismiss, easy to joke about, easy to ignore. But inside the body, something important is happening. The prostate is a small gland about the size of a walnut located just below the bladder. Its job is to produce fluid that nourishes and protects sperm. But as men age, this tiny gland often begins to grow. And when it grows, it presses against the urethra, the tube that carries urine out of the body. This condition is called benign prostatic hyperplasia, or BPH. It is not cancer, but it affects more than half of men over 50 and up to 90% of men over 80, according to large epidemiological studies. That means this is not rare. This is normal aging biology. But normal does not mean harmless. The first sign many men experience is frequent urination. You may find yourself going to the bathroom more often during the day. You might think it's just because you're drinking more water, but the reality is deeper. As the prostate enlarges, it narrows the urethra, making it harder for urine to flow freely. Your bladder has to contract more forcefully to push urine past the obstruction. Over time, this constant strain can irritate the bladder and increase the urge to urinate. Then comes the nighttime awakenings. You go to bed hoping for deep sleep, but your body wakes you up at 1 a.m., 3 a.m., 5 a.m. This is called nocturia, and it is one of the earliest and most disruptive symptoms of prostate enlargement. Studies show that poor sleep from nocturia is linked to higher risk of depression, cardiovascular disease, and metabolic problems. So a prostate problem can silently affect your heart, your brain, and your hormones. Another early sign is a weak urine stream. You stand at the toilet, but the flow is slow, thin, and takes longer than it used to. Many men laugh this off, thinking it's just part of getting older. But this is physics inside your body. The enlarged prostate acts like a clamp on the urethra, reducing the pressure and speed of urine flow. Research using urodynamic testing shows that men with BPH often have significantly reduced urinary flow rates compared to younger men. Sometimes the problem isn't the flow, but the start. You stand there waiting. Seconds feel like minutes. Your bladder is full, but the urine doesn't come out right away. This happens because the muscles of the bladder must overcome resistance from the prostate. Over time, those muscles can become fatigued, leading to even more difficulty. Then there is the feeling that never goes away. You finish urinating, but your bladder still feels full. You walk away, but minutes later, you feel pressure again. This is called incomplete bladder emptying. Residual urine left in the bladder can increase the risk of urinary tract infections and bladder stones. In severe cases, it can even damage the kidneys. Some men notice dribbling after urination. You think you're done, but drops continue to leak. This is another sign that the urinary system is not working efficiently due to obstruction and weakened muscle coordination. And sometimes there is discomfort, a dull pressure in the lower abdomen or pelvic area. Not sharp pain, not unbearable, just something that feels off. That pressure is the bladder and prostate interacting in a space that is becoming more crowded. Here's the shocking part. Many men live with these symptoms for years without seeking help. They normalize it, they joke about it, they think it's just aging, but ignoring these signs can lead to serious complications. Severe BPH can cause acute urinary retention where you suddenly cannot urinate at all. This is a medical emergency that can require catheterization or surgery. Chronic obstruction can lead to bladder thickening, loss of bladder function, and kidney damage. And yet, early symptoms are often subtle. They creep in slowly, so slowly that you adapt without realizing how much has changed. Science shows that prostate growth is influenced by hormones, especially dihydrotestosterone, or DHT. As men age, the balance of testosterone and estrogen shifts, stimulating prostate tissue growth. Inflammation, oxidative stress, and lifestyle factors like diet and physical inactivity also play a role. But early detection changes everything. When symptoms are recognized early, lifestyle changes, dietary adjustments, and medical therapies can dramatically improve quality of life. Early intervention can prevent complications and reduce the need for invasive procedures. Your body is constantly communicating with you. Frequent urination is a message. Nighttime awakenings are a message. A weak stream, hesitation, pressure, dribbling, these are messages. The tragedy is not that the prostate grows. The tragedy is that men often stop listening. Imagine getting a warning light in your car and ignoring it for years. Eventually, the engine fails. Your body deserves more attention than your car. If you're noticing even one of these signs, it doesn't mean something is wrong with you. It means your body is aging and adapting. But awareness gives you power. Power to change your diet. Power to improve your lifestyle. Power to seek medical advice when needed. Power to protect your sleep, your comfort, your health. The prostate may be small, but its impact on your life can be enormous. And the earliest signs are whispers. If you listen to them now, you can avoid the shout later. What you eat every day is not just fuel, it is information. It is a chemical message that tells your prostate cells whether to grow, inflame, or heal. Most men think prostate problems are inevitable. They believe aging alone decides their fate. But science tells a different story. Your daily habits can either accelerate prostate enlargement or slow it down dramatically. Let's start with inflammation. Chronic inflammation is one of the key drivers of prostate enlargement. Research shows that inflamed prostate tissue grows faster and becomes more sensitive to hormonal signals like DHT, the hormone that stimulates prostate growth. And the modern diet, high in sugar, refined carbs, and processed fats, is a powerful trigger for inflammation. Now, imagine using food as medicine. Tomatoes are one of the most studied prostate protective foods in the world. They contain lycopene, a red pigment with powerful antioxidant properties. Large population studies have found that men who consume more lycopene-rich foods have a lower risk of prostate enlargement and prostate cancer. Cooking tomatoes actually increases lycopene absorption, meaning tomato sauce, soups, and stews may be even more powerful than raw tomatoes. Then there are pumpkin seeds. These tiny seeds are loaded with zinc, a mineral critical for prostate function. The prostate contains one of the highest concentrations of zinc in the body. Zinc helps regulate cell growth and hormone metabolism. Clinical studies suggest pumpkin seed extracts may reduce urinary symptoms in men with benign prostatic hyperplasia. Just a small handful a day can be a powerful habit. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain sulforaphane and indole-3-carbinol, compounds that help the body detoxify excess hormones and reduce inflammation. These vegetables support healthy estrogen and testosterone balance, which directly influences prostate growth. Men who regularly eat cruciferous vegetables have been shown to have better prostate health markers in observational studies. Green tea is another silent protector. It contains catechins, powerful antioxidants that can slow abnormal cell growth and reduce inflammation in prostate tissue. In some clinical trials, green tea compounds have been shown to slow prostate cancer progression and reduce prostate-specific antigen levels. 1 or 2 cups a day may seem simple, but the cellular effects are profound. Healthy fats are critical too. Omega-3 fatty acids from fish like salmon, sardines, and mackerel help reduce systemic inflammation. Inflammation is like a constant fire inside the prostate, and omega-3s help extinguish that fire. Studies show that men who consume more omega-3 fats have lower levels of inflammatory markers linked to prostate disease. But diet is only half the story. Your lifestyle is a powerful hormonal switch. Physical activity is one of the most underestimated prostate therapies. Exercise improves circulation to the pelvic region, enhances hormone balance, and reduces insulin resistance. Insulin resistance is linked to increased prostate growth because high insulin levels stimulate cell proliferation. Even a 20 to 30 minute daily walk can lower insulin levels and improve urinary symptoms. Hydration timing is another secret most men never learn. Drinking water is essential, but drinking large amounts late at night can worsen nocturia. By shifting most fluid intake earlier in the day, many men experience fewer nighttime awakenings and deeper sleep. Caffeine and alcohol are powerful bladder irritants. They stimulate the bladder and increase urinary urgency. Studies show that reducing caffeine and alcohol intake can significantly improve urinary symptoms in men with enlarged prostates. Stress is a hidden enemy. Chronic stress increases cortisol, disrupts testosterone balance, and increases inflammation. High stress levels are linked to worse urinary symptoms and faster progression of prostate problems. Simple practices like deep breathing, meditation, and regular relaxation can change your hormonal environment. And then there is body fat. Excess body fat converts testosterone into estrogen through an enzyme called aromatase. Higher estrogen levels stimulate prostate tissue growth. Weight loss and improved body composition can directly slow prostate enlargement. Here is the shocking truth. Many prostate symptoms that men believe are irreversible can improve dramatically with diet and lifestyle changes. Clinical studies show that lifestyle interventions can reduce urinary symptoms, improve flow rate, and reduce inflammation markers. Your prostate is not powerless. It is dynamic. It responds to every meal, every step, every hour of sleep, every stress response. Think about that for a moment. Every time you choose whole foods over processed foods, you are sending healing signals to your prostate. Every time you move your body, you improve blood flow to tissues that desperately need oxygen and nutrients. Every time you sleep deeply, you rebalance hormones that control prostate growth. This is not about perfection. This is about small daily decisions that compound over time. A bowl of tomatoes today, a handful of pumpkin seeds tomorrow, a walk after dinner, a cup of green tea in the afternoon, less soda, less alcohol, more vegetables. These are not dramatic interventions, but biologically they are powerful. Your prostate is influenced by chemistry, and chemistry is influenced by lifestyle. You are not a victim of aging. You are a participant in it. The food you eat can either fuel prostate inflammation or calm it. Your habits can either accelerate enlargement or slow it down. And the most shocking fact of all, many men never hear this information until symptoms are severe, but now you know. Your daily choices are shaping your prostate health right now, silently, at the cellular level. And the sooner you start, the more control you gain over your comfort, your sleep, and your quality of life. Most men wait. They wait until symptoms become unbearable. They wait until sleep is destroyed. They wait until daily life becomes a struggle. And by the time they act, the problem is no longer small. The truth is simple and uncomfortable. When it comes to the prostate, early action can mean the difference between comfort and years of discomfort. Your prostate does not suddenly become large overnight. It grows slowly, silently, over years or decades. And that slow growth gives you a powerful advantage if you choose to use it. Medical research shows that benign prostatic hyperplasia, or BPH, progresses gradually. In its early stages, symptoms may be mild, but the biological changes are already happening at the cellular level. Cells are multiplying, inflammation is building, hormonal signals are shifting. But here is the shocking fact. In early stages, these processes are far more reversible and manageable. Studies have shown that early lifestyle changes, such as diet, exercise, and weight management, can significantly reduce urinary symptoms and slow prostate growth. Some clinical trials show symptom improvement comparable to medications, without the side effects. Think about that. A few changes today can spare you years of frustration tomorrow. One of the first things that suffers when the prostate enlarges is sleep. Waking up multiple times a night to urinate may seem harmless, but sleep deprivation is linked to heart disease, diabetes, cognitive decline, and even early mortality. When you act early, you protect not just your bladder, but your brain, heart, and entire hormonal system. Quality of life is not a small thing. It is how you feel when you wake up. It is how confident you feel in public. It is how relaxed you feel traveling, working, or socializing. Many men with untreated prostate symptoms plan their entire day around bathroom access. They avoid long trips. They avoid social events. They feel anxious about meetings, flights, or long drives. This silent anxiety can erode confidence and mental health, but early action changes that trajectory. Medical guidelines emphasize that early evaluation and management of urinary symptoms can prevent complications such as urinary retention, bladder damage, and kidney problems. Acute urinary retention, when you suddenly cannot urinate at all, can happen without warning in advanced cases. It often requires emergency catheterization and sometimes surgery. This is not meant to scare you. It is meant to empower you, because the earlier you act, the less likely you are to face those scenarios. Early action also means more options. In early stages, many men can manage symptoms with simple strategies: dietary changes, exercise, weight loss, stress reduction, herbal supplements under medical guidance. In later stages, options may include long-term medications or invasive procedures, so timing matters. Hormones play a massive role in prostate growth. As men age, the balance between testosterone and estrogen shifts. Dihydrotestosterone, or DHT, accumulates in prostate tissue and stimulates growth. But lifestyle factors influence these hormones. Research shows that obesity increases estrogen levels and DHT activity, accelerating prostate enlargement. Weight loss can improve hormone balance and reduce prostate-related symptoms. Insulin resistance, common in sedentary lifestyles, is also linked to prostate growth. High insulin levels stimulate cell proliferation in many tissues, including the prostate. Early action through diet and exercise can reverse insulin resistance and slow cellular growth. This means your daily habits are not just habits, they are biological switches. Another overlooked benefit of early action is sexual health. Prostate problems can affect ejaculation, libido, and overall sexual confidence. Chronic urinary symptoms can reduce intimacy and emotional connection. By acting early, you protect not only your health, but your relationships. There is also the psychological burden. Chronic discomfort, interrupted sleep, and constant urgency can lead to anxiety and depression. Studies show that men with severe lower urinary tract symptoms have higher rates of mental health issues. Early symptom control improves mental well-being. Here is a powerful truth. Your body is constantly trying to heal. It is not broken. It is adaptive. When you give it the right signals, nutrients, movement, sleep, stress control, it responds. Prostate tissue is dynamic. Inflammation can decrease, muscle tone can improve, bladder function can recover, but the window of opportunity is widest at the beginning. Think of it like a tree. When a branch is small, you can guide it easily. When it becomes thick and rigid, change becomes harder. Early action is not about fear. It is about respect for your body. It is about listening when the body whispers instead of waiting until it screams. Many men delay seeing a doctor out of embarrassment, but prostate symptoms are among the most common issues in men worldwide. Doctors discuss these problems every day. You are not alone. You are not unusual. You are human. Screenings, symptom questionnaires, and simple tests can provide clarity and peace of mind, and in many cases, reassurance that the condition is benign and manageable. The most shocking fact is how many men regret waiting. When interviewed, men with advanced prostate symptoms often say they wish they had acted sooner. They wish they had changed their habits earlier. They wish they had taken those early signs seriously. You don't have to be one of them. Every day you delay is another day your prostate continues its silent transformation. Every day you act is a day you push back against that process. Imagine waking up without urgency, sleeping through the night, traveling without anxiety, feeling in control of your body again. That is what early action can give you. Your prostate is not just a gland. It is a gatekeeper of comfort, sleep, confidence, and dignity. And you have more control than you've been told. The earlier you act, the more power you reclaim. The sooner you start, the easier the journey becomes. Your future self will thank you for the decisions you make today. Listen to the whispers, respect the signals, and take action while the change is still gentle. Because when it comes to your prostate, early action is not just treatment. It is prevention, protection, and preservation of your quality of life.